Hey y'all, so today I'm going to be doing a tutorial on how to lay your edges. Say no. But today I'm going to be talking to you about therapy, psychotherapy, talk therapy, first session, kind of what to expect, what questions you might be asked, and why it's important for you to not quit after your first session, because a lot of times we go to therapy or some people go to therapy and they don't go back, and then they tell their friends like, I went, it didn't really work, you shouldn't go either. So I just want to do a video just to kind of clear up some confusion for people who may have a bad outlook on that first session, because the first session doesn't really give you the help that you need. And so just talk about that. So basically, psychotherapy or talk therapy, it is a period of sessions that you go through to there's multiple visits that help you reach your goal. So like I said in my last video, you could go to therapy for whatever reason you feel is necessary, whether it's small or big, and from there you and your therapist will kind of determine how many sessions you should have, and then have, you know, goals that you want to hit, milestones you want to hit, things like that. So psychotherapy, talk therapy, I don't know, I'll just say psychotherapy. Therapy is not an instant fix. So it has, you know, it has to happen over a period of time. So you have lifelong solutions, and it's not a quick fix. So it's something that you felt was serious enough for you to see a therapist. So it's gonna require more than 1 or 2 visits for you to get what you need out of it. So the initial visit is gonna be different from the visits that follow. The first visit is like the informational visit, the questionnaire, the let's get it out there. This is the opportunity for your therapist to get to know you, and for you to also get to know your therapist. So your therapist will be asking you a lot of questions, but it's important that before you go, if you're nervous about anything, just for you to write down questions of your own, and that way you can take those questions to your therapist just to get a better understanding of them. Now, in this, if you feel like your therapist isn't best for you based off of, I don't know, personality, or y'all just don't mesh, the first visit can be determined in the first visit. And at any point during your sessions, you can always request a new therapist or draw from therapy. But I'm not saying this video because you don't like your therapist and you should stick with that person. This video is more so for people who went to a first session and had different expectations and they didn't return because it wasn't what they thought it was gonna be. So the second session, so the first session is informational, and then the second session and the sessions from there are the ones that are therapeutic and healing. So the first session is kind of like if you go to, I say physical therapy or a doctor's visit. You go in there, you tell them what's wrong, and from there they do their research, they do, homework on you, your condition, your symptoms, what you're telling them, what you're feeling. And then the next time you see them, they'll give you a better assessment and they'll be able to help you treat yourself better. So if you go to physical therapy, typically the first session is when, you're stretching, they're, asking you to raise your arm to see how far you can go. They're poking and feeling what hurts, and they're trying to figure out the source of your pain, where the pain is. And then the next session, that's when they start to do the therapy, they start to do the healing. So that's when you start to do exercises and things like that. And just like physical therapy, the first session of therapy can be very draining, and it can be very painful because it's opening up wounds. It's stretching that part of your emotions that you typically would not expose yourself to. So if you have a bad ankle or something, you might, walk with a limp, or you're trying not to put pressure on it, but you go to therapy and they're going to twist and pull and turn, and then you leave and you hurt. So first session of psychotherapy is just like that. So typically before you walk in to see your therapist, you'll get a questionnaire. Questionnaire will just ask your background, typical demographic information, where you live, what you do for work, things of that nature. Then it'll also ask you questions about your medical history, if you have history of, stroke, heart attack, things like that, and in your family as well. And then it'll ask you about your mental health. So it'll ask you, have you ever tried to commit suicide or had suicidal ideations? It'll ask you, have you ever had mental health issues, or have you ever had try to commit self-harm, or have you ever been successful at self-harm? It asks you when you did that, things of that nature. It'll ask you, have you ever been physically abused? Have you ever been sexually abused? Have you ever been mentally abused? It would ask you, family history. Has there been any domestic violence in your family, or have you been a victim of domestic violence? So they ask you all of these things, and you do not have to answer those questions on that paper if you don't feel comfortable, because that paper will be going to your therapist or your doctor, and that'll be like the guideline for asking you about yourself, because yes, they can just read the paper, but they want to hear these things from you just to ensure that this is truly you on this paper, and to ask you if you left out anything. And it's kind of like an outline for them where they'll take notes along things. So if you have had physical abuse and you go into detail about it when you're talking about it, they'll write that beside your entry, and then of course later they'll log it for their records. So once you finish your questionnaire and then you get to see your therapist or doctor, then they'll ask you more questions. So again, they might use that as an outline, the questionnaire, what's your name, age, what do you do for a living, things like that. But then they might ask you more questions like, what brought you here? And for this, that's an open-ended question. You can say, I came here to, get help on one thing, or you could tell them everything about your childhood, everything about your relationships, and you could just be an open book there. They might ask, what do you feel is wrong in your life? And you might say, nothing is wrong in my life, but this is what's happened in the past. I'm better at it, but it's still a lingering thought. Whatever that answer is, that's your answer. That's going to be between you and your therapist. So for all the questions that are asked, as long as you do not actively feel like you want to harm yourself, harm others, harm children, harm elderly, and you don't have a plan for any of these things, everything is confidential. Now, again, like I said in my past videos, if you start to mention these things, they have to legally report these things, because, we don't want anything to happen to you or happen to other people. So then they'll ask you, what are some of your symptoms? So they might ask in the questionnaire or in person, they might ask, do you have depression? Do you have anxiety? Do you have PTSD? Do you have these things? And so you might say yes, and then they'll ask you, what are your symptoms? Because we might think that we have something, and based off our symptoms, we are categorized as having something completely different. So anxiety typically follows along the same path as PTSD, but PTSD has more symptoms. Depression might fall under PTSD, but PTSD has, again, different symptoms. So we might be saying I have PTSD, but in actuality, you might have anxiety. So these are helping them to know you better, to know how to better treat you. So again, they'll be asking you questions about your history, like your childhood, your education, your relationships, your relationship with your family, your relationship with your friends, and then your romantic relationship history. And then that kind of gives them a better view of you. So if you've never had a relationship before, that might spark questions in them to see, what might be going on in your head. If you've had any trauma as a child, how might that play a role in your work relationships, things like that. So then they'll ask you your living situation. Do you live by yourself? Do you live in an apartment? Do you live in a house? Do you live in the country? Do you live in the city? Things like that. And then your career, what are you doing for a living? Because all of these play in a role with how you feel, how you operate, how you move. Again, they'll ask you mental health and family history. So does depression run in your family? Does anxiety run in your family? Does these things of trauma run in your family? And then medical history with that as well. Does your mom have history of high blood pressure, things of that nature? Again, they will ask you about your history of suicidal ideations. If you've had it, if you've never had it, what year did this happen, what age, what was going on in your life to make you want to commit suicide or think these thoughts? Did you have a plan? Things like that. Then they'll ask about self-harm. So do you have a history of self-harm? Again, what did you do to harm yourself, or what were the thoughts that you had? And they'll ask you more questions like this. And again, it's for them to kind of see where you are, where they want to go from in the future. So then they'll ask you, they may ask you, what do you hope to gain from therapy? What do you hope to gain from therapy with me? And that'll be completely up to you. So this is why it's important for you to do research before you go into therapy, because you might not know what you want to get from therapy. Your friends might have just told you to go, and you don't even know what you want to get from it. So this is important to know what you want to get from it. You want to get coping mechanisms, or you want to get better sleep habits. You want to be able to manage your stress better. You might want to be able to practice mindfulness more. So these are things that they might add. These are things that may be a goal for you, but again, you might have to research a little bit to figure out what therapy can do for you. And then another question could be, what do you wish to accomplish from the specific session? So you want to leave with a better sense of hope, or you want to leave feeling better, or things like that. So the first session is the hardest session because it makes you completely vulnerable. You open yourself up to this stranger and you leave walking away with sometimes nothing but maybe a pamphlet or a handout about some exercises to help with like meditation or sleep or mindfulness or something like that. And it can be discouraging if you don't know what to expect, but if you go in there knowing what to expect, it'll help you out and it'll help you be able to walk away with a better outlook on your sessions in the future. And in that first session, your therapist may tell you, you know, I'm only going to do these 6 sessions or 6 months of sessions or whatever. And that's important for you to take account of that, because we want you to make sure you take these sessions seriously, because whatever you disclose to your therapist and whatever you keep from your therapist will play a role in how successful your sessions will be. So I hope this I don't want to say short, I hope this video was informative to you. I hope that if you had any doubts about your first session, or you went to a first session before and you didn't go back because you didn't get out of it what you wanted, I hope this video helped you think about that. I hope it, you know, helped inform you of what to expect, what not to expect, and you know, helps you or your friends or somebody to get that first step in the door to get into therapy that they need for, again, whatever it is that they need it for, because therapy helps with everything. So as always, thank you so much for watching this video. I truly hope that you enjoyed it. If you did, please like it. Please subscribe to my channel, because the content will, again, only get better, only get more in depth, only help you and your friends more. Please share this video if it has helped you, or if it hasn't, please share it, because you never know, it might help somebody on your timeline or in your circle. And please comment if you did like this feedback, or if you wish that I said something different, or if there's anything that could have helped you. As always, have a great day. I hope to see you soon, and you know, let's get this mental health together.